welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and I'm going to discuss about the increasing rate of obstructive coronary artery disease in both young men and women, accounting for 10% of all coronary artery disease cases and all of them requiring a percutaneous intervention. The study is recently published in the Indian Heart Journal. Now, in developing countries like ours, cardiovascular diseases have surpassed cancer as the leading cause of death and morbidity. Now, in reference to the United Nations Declaration on Non-communicable Diseases in 2011, the WHO defined a target of lowering the likelihood of premature death from these by 25% by 2025. So this retrospective study, it aimed to explore the prevalence of risk factors as well as the trends of obstructive coronary artery disease in Indian females under the age of 45 compared to males of the same age group who underwent a PCI procedure at 3 high-volume centers in India. Out of the close to 3,600 patients who were enrolled for the study, 3.1 of these had an obstructive coronary artery disease. They were young women, while 6.9 were young men. Traditional risk factors such as hypertension, diabetes, and family history of premature coronary artery disease were equally common in both the genders, whereas dyslipidemia, overweight, smoking, and alcoholism were more common in the males. The results of the study showed that acute coronary syndrome was the most common clinical presentation. Single vessel disease was common with the involvement of the left anterior descending artery as the most common angiographic feature. The prevalence of cardiogenic shock was 4.4% in females and 4.1% in males, while the in-hospital mortality rate was 1.77% in young females and 2% in young males. Therefore, in conclusion, obstructive coronary artery disease in young men and women accounted for 10% of all the coronary artery disease cases requiring a percutaneous coronary intervention. Now, although men accounted for the majority of the patients, coronary artery disease in women under the age of 45 was not uncommon. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.